My name is Soowan. I was a student at the University of Toronto. I was a master's student and I just finished last November. And today I'll be discussing my thesis project, which focused on validating the accuracy of a 3D depth camera used in movement tracking video games for children with cerebral palsy. So this is just a brief overview of what I'll be discussing today. I'll go into a more in-depth for Objective 1 and Objective 2, and my results and the discussion afterwards. So starting with the project motivation. So what is cerebral palsy? It's a prenatal brain development disorder that affects 2 to 3 children for every 1,000 births. That means that the children can't really move their body in a way that we can, so they have a lot of trouble lifting their hand up their shoulders. There are currently 2 main types of treatments for cerebral palsy. The first is physical therapy, and the second is occupational therapy. But there's currently limitations to these in-person therapy because it might be far for patients that live far from the hospital, and it's also a big cost and time commitment. So several studies have looked at active video games as a potential for complementing in-person therapy, and that's because they're portable, they're very cost and time effective, and several studies have also found it to be boosting motivation in children for rehab. So the proposed solution at my lab was to create 2 video games. They're called Buddha Blast and Buddha Boot Camp, which targets both upper body and lower body movements respectively. And both of these games focus on using camera sensor for tracking the actual joints as the children play the games. So the sensor I'm talking about is in figure 1 on the left. It's called the Orbit Perceive Plus sensor. And this camera was compared to the gold standard figure 2 motion capture system. And we call it the gold standard because there's 12 cameras circumference the room, and it targets all the joints and is very accurate. So the first objective I was trying to look at was how accurate is this sensor? So to actually understand the accuracy of the joint and the kinematic metrics as the patients play the games. And then the second objective was to understand, okay, so if it is accurate enough, how good is it at quantifying the qualities of movement and providing accurate feedback for any games in the future that might be created using this sensor. And here I'm defining clinical utility as a potential for it to be used in a clinical setting. So going into the actual methods, I recruited a total of 28 participants, 20 adults and 8 children. Two of these children were diagnosed with cerebral palsy. And the joints of interest are shown here. So they're the full body from the foot, the knee, the hip, the shoulder, elbow, wrist, and the head joints. So each of these participants were asked to come to the hospital. As seen in figure 1 was the setup. I calibrated the 12 cameras I mentioned, the gold standard, the motion capture cameras. And then I attached these reflective stickers as seen in figure 4 to each of the joints I just mentioned for these cameras to track the participants as they play the games. So for the first game, it's called Buddha Blast, and I selected 5 specific mini games from this overall game. And these games were mainly chosen because they targeted different types of movements. For example, in Wizard's Adventure, there's a lot of abduction, adduction movements, which just means lifting your hand on your side. And compared to Astro Boodle, which had a lot of trunk lateral lead movements, so just leaning side to side. The second type of video game we were looking at was 18 exercises that target a lot of the lower body movements. And these range all the way from strengthening exercises, all the way to cardiorespiratory exercise, such as running on the spot. I also looked at 4 additional clinical assessments. So this was the reach test, standing still and reaching out, the standing on one leg stance, the 5 times sit to stand test, and the time up and go test where we have the participants sit at a 3-meter distance from the TV screen, get up, walk to the screen, touch the screen, come back, sit down, and we time that duration by tracking the joint movements. So going into the results of the objective 1. So again, the objective of the first, aim was to understand the accuracy of this Perceive Plus sensor camera. The main, software I used for cleaning the movement data was Python. So I transferred the coordinate systems. What that means is that since I have the camera and the motion capture cameras, I had to align those coordinates so that we're tracking the same joint movements. And then I synchronized the data by asking each of the participants to make 3 large class B for each of the games so I can understand when the game actually was beginning. And then I downsampled the frequency, so the camera systems, they track the movements at different cycles per second. And so I had to align that and then filter the noise to make sure there's no discrepancies between the data. So the 5 clinical parameters I looked at was the raw joint coordinate data, the body segment length, the maximum joint angle, the maximum hand reach, and the maximum and average hand speed. So going into the actual raw joint coordinate data, these are a lot of numbers, but if you just look at the overall color graph, it seems to be a lot lower correlation or lower accuracy for tracking lower body joints. So when comparing the Per C Plus camera to the motion capture system, there's a lot lower accuracy when tracking the hip, knee, and ankle joints overall. For the body segment length, since the body segment length is a fixed length, there shouldn't be a lot of noise. How do we determine the noise in the data? We use the coefficient of variation at each segment of the collected data. And what we found was that although it is within reasonable coefficient of variation, there's a lot more noise for the hand movements where the actual game was targeting that side. So on the graph on the left, for the power right game, there's a lot of right hand movements, so there's a lot more noise when calculating the upper arm and the forearm body segment length. And for the maximum joint angle, we found out there was a lot lower accuracy when looking at the seated exercises and for tracking the hip angles for seated exercises. For the maximum hand reach, there's a lot lower accuracy when looking at, so if that's a camera that I'm sitting at right now, towards the camera, so any movements towards the depth of the camera, there's a lot lower accuracy, but it was still reasonable compared to several studies from the past. And finally, for the maximum and average hand speed, there's a lot more noise for games that required a lot more quicker hand speed. So the power games had a lot more diverse hand movements, which was why it had a larger RMSE value. So in conclusion, for the first objective, there was a higher correlation or higher accuracy for tracking upper body joints. And there was overall lower tracking precision for any hand speed that was greater than 0.18 meters per second. But overall, we found that there was excellent concurrent validity and good accuracy and good to excellent inter-rater reliability. So going into the second objective, again, the second objective was to understand the clinical utility of the sensor for quantifying the qualities of the movement. So what are these quality metrics? These were something that I consulted physical therapists to understand for each of the exercises, okay, what's a reasonable outline? So for example, in squat, the participants couldn't move side to side more than 15 degrees, and the knees had to be within a 10-centimeter range when making movements from the shoulders. And then I visualized this using the Unity program. And the two main parameters I looked at were the duration and the repetition of these exercises. So some of the exercises, they had a lot of repetitions. For example, they had to make 10 squats versus duration. The exercise would be running on the spot, so how long can they actually be tracking the movements while they're running on the spot? So from the results, there were several exercises, so it was very randomized, but star jumps, seated knee extensions, the seated star jumps and 30-second sit to stand tests had the best accuracy when tracking the repetitions of exercises. And then for tracking the duration of the actual exercises, there was a lot more accurate, there was higher accuracy for tracking running on the spot, 4-step test, and the standing calf stretch. And so from these results, what we could conduct is that some of these exercises can be implemented into the game as is, so there's no modifications needed. Whereas some of these exercises we could understand, okay, where can we consult to make sure that the quality metrics are reasonable compared to what the physical therapist said, and how much can we modify it from the actual values that we've conducted to understand if modifications are required to make sure that the accuracy is increased. In conclusion, from the first objective, the sensor can be provided as a platform for intervention for children with cerebral palsy, so it can be performed at the comfort of the family's home. And in the second objective, the lower body exercise that we looked at can be used to provide accurate feedback on the quality of the movements so that they can actually correct their movements as they play the game in lifetime. And overall, the two key significant takeaways that you guys can take from my study is communication and data analysis. Communication, since healthcare is a very interdisciplinary collaborative environment, and data analysis, we live in a digital age, so data is everywhere. Thank you.
Thank you for